Hi guys, thanks for joining us for another episode of The Antidote. So I'm Abdullah Al-Biati, I'm the NHS GP who likes to voice his opinion. I've got with me Bara Mustafa, who is a very close friend and somebody who works with ourselves at Medical Change. So Bara, if you'd like to introduce yourself.
Yeah, I'm Bara Mustafa. I'm the CTO at Medical Chain. I lead a team of developers developing our myclinic.com app, which we're heavily working on and hope to have ready very soon.
Fantastic. So I thought for the purposes of this video, it'd be great to have insight from somebody coming from a different background, a different angle at our healthcare problems. So Bara, as he said, is our Chief Technical Officer. So he is in charge and leading our integration within the NHS and the other complexities of trying to do that. So how have you found it so far? How long have you been working on this and any challenges you've come across?
So I've been with Medical Chain since the beginning. Obviously, I've been working in my role for the last several months. Challenges working with the NHS is very broad. You've got the challenges of regulation on one side, dealing with healthcare data, how you manage it, what the legal requirements are. On the other side, dealing with, I hate to say it, but red tape in the NHS, how you integrate, where you get the integration options from, and how to get access to patient data. And that's what we have to try and deal with every day.
So as a doctor, or even as a patient, we get told by the NHS all the time, or NHS England or NHS Digital, that they're making huge strides to getting patients to have access to the information. They're making huge efforts to improve interoperability. So the idea of trying to connect different systems to talk to each other and share information. Has that been your experience so far?
No doubt they are making strides, but the NHS is a big machine, and it's just a slow progress. And we as a small organisation are very agile, and we move quite quickly, a lot quicker than the NHS does. So we're always eager to get these connectivity options, whereas we're still waiting on parts of the NHS to give us access to options or make options available to us that aren't available to us today.
And do you think, from your experience now, working much closer to the health tech side of things, especially within our healthcare sector, do you think there's a before and after effect for you, where you had maybe some ideas before you started working here, and since working here you realise that there's actually some misconceptions you may have had?
Absolutely. So working with healthcare data is not the same as working with other data. I think each industry proves its own problems. I've previously worked in the IT security industry, and there's issues there, but that tends to be a very private sector, and organisations tend to move quite quickly, and you have to move quickly in that sector. In the healthcare sector, you tend to be working with groups and organisations who have been doing things for many, many years the same way, and it's about changing minds, changing the approach that people are taking, and telling people that there are different ways of doing things, and we are here to try and help and open up avenues to make things better for everyone.
Great, thank you very much for those answers. You've established that you've got a clear remit of what you're trying to achieve. You've got a very agile and active and enthusiastic team working under you as well. So as a GP, I know that we work with a system called EMIS, or another one called TPP or System 1, which are our electronic health record systems that most of the GPs in the country work with. What's your experience of trying to work with them, and how do you see the future going forward with them as well?
So both these providers do a lot more than just electronic healthcare records. So I've come to learn that these providers deal with all the information around charging, so billing, how they bill the NHS for the work, how they code information, so that's the way they record what interactions they've had with patients, so that the NHS can pull out analytics for them. Obviously they deal with the scheduling and booking details for the doctors. So they're not just simple electronic healthcare data systems, they do a huge amount. Obviously from our concern as Medical Chain, we care about the patient healthcare records, and that's the part that we want from those providers. We want to be able to pull that data and give patients access to them. From an EMIS point of view, it did take us a little while, but we had success getting access to the EMIS development environments that we can work with, and that's what we're building on. From a TPP point of view, unfortunately, we've had no luck with them. We've tried many avenues using the NHS pairing integration system, but all the people that we've spoken to said there are a lot of organisations in the same position that we are at the moment, in that the TPP have no vested interest. They have a contract with the NHS and they're adhering with their contract and meeting their obligations under the contract, but they're not going anywhere above and beyond to help any other providers get access to data.
What do you think their agenda is? Why don't you think they want to help others?
I think from a financial point of view, they see, they're adhering to their contracts. Why should they need to go above and beyond? They've got lots of other objectives to deal with, probably within their teams and within their organisation, and hence they don't see it as a priority for them to give access to patient data to other providers.
Yeah, I think that's definitely an attitude which sometimes people working within the NHS are unfamiliar with. I know that a lot of people working in the NHS, my colleagues, reception staff, nurses, doctors, they go above and beyond for their patients in the NHS, and they become quite surprised when they don't see private companies or entities working in the same light. I think something which they miss is that they are private companies and entities. They work on contracts, they work on billing, and they're more than happy to do this extra work because it is extra work. I mean, is it a case of them just flicking on a switch for us, or do you think it actually takes some time and effort for them to do this?
I don't think it's the case of just switching on just a quick switch, but I don't think it's a huge amount of work. But I mean, I don't know the ins and outs of their system, so but realistically, I mean, from my point of view, I'd like to see the NHS push them more. I'd like to see the contracts with them be stronger, so that patients are at the heart of the NHS, and the NHS has more control over the data that these organisations control on behalf of patients.
I think you hit the nail on the head there. The only people that can really push this and throw their weight around are the NHS. And they have to keep at the core of their contracts that this is actually going to benefit patients in the end. Yeah. If they let companies, including ourselves, get away with things that are not for the patient's interest, then what's the point of trying to represent them? I mean, I suppose the point of us doing these vlogs, us building the company medical chain, working together on it, and the passion that we have in the team is that we just got to a point where we realised we can't leave it to others to do this, and we have to do it ourselves.
There are approaches we're taking though. There are other avenues down the NHS which the NHS are working on. They're just slow, they're just behind schedule, but we're still working along those lines, and we're trying to get our patients their data.
Excellent. Well, fingers crossed. We've got Matt Hancock, who's very keen on pushing all these digital solutions. So hopefully he will try to push these. I know he's said a lot of things about trying to empower patients and empower patients to interact and remove health barriers for them and their clinicians. Bara, thanks so much for your time. I really appreciate it. One quick question before you go. It says a lot about a person, I think, this key question. Who's your favourite Ninja Turtle and why?
I'd say Raphael because my son loves him. But I think I'm more of a Donatello.
I think for people that know Bara, that's very accurate. It's quite the smart, nerdy guy is definitely Bara in the team. Donatello was my favourite as well, to be quite honest. And your son is a bit of a terror like Raphael, so I think that's a good answer. Thanks for joining us on The Antidote. Like, share and subscribe, and we'll see you on the next one.
Thank you.
Cheers.